Good evening, colleagues. Welcome to our monthly feature, RCMA call, physician to physician with Riverside County Public Health Officer, Dr. Geoffrey Leung. We will be asking him questions. He'll initially give some updates about the county situation about COVID. Over to Dr. Leung.
Thank you, Dr. Singhvi. So, just in terms of updates, I wanted to cover maybe three areas first. One is just a general overview of some of the numbers. Secondly, to highlight some of the vaccinated and unvaccinated data that we've recently posted. And then third, there was an announcement actually from the Biden administration today, and we can do a very short recap of that before we get to the questions, if that sounds all right. So first of all, in terms of our COVID numbers, compared to last month when our numbers were actually increasing, for the first time, we're starting to see some encouraging trends with our positivity, our case rate, and our R effective. All three of those sets of numbers are now moving in the right direction. They are all decreasing. And our COVID hospitalizations also look like they may have been to decline. The lagging number will have to do with COVID deaths, so we don't expect that to drop as quickly, but we are hopeful that the numbers are starting to move in the right direction. And that's also consistent with what we're seeing across Southern California as well as the rest of the state. In particular, our positivity right now is at 7.8%. We were up in the 12% range before. Our case rate is now 27.2 out of 100,000. And then our hospitalized as of today was at 601. It actually has decreased by about 60 or 70 just in the past few days. Our total vaccinated, when you look at our 12 and up population, partially or fully vaccinated is 63.4, 55. If you look at our 65-year-old and up population, 77% of them have been partially or fully vaccinated, and 69.3 of them have been fully vaccinated. But we recently did post some data on vaccination and unvaccinated and vaccinated individuals in Riverside County. So this may be a small graphic, and I'll just kind of read off some of the highlights. So when you look at kind of our collective data for the vaccinated and unvaccinated individuals in Riverside County, unvaccinated individuals have had approximately 37 times a greater likelihood of having COVID and 120 times greater likelihood of dying from COVID than fully vaccinated individuals. This is over sort of a longer time period. And so if you see or hear any numbers that don't make sense, sometimes numbers may vary depending on what time course we're looking at, whether it's the past month, the past 6 months, etc. But if, in this graphic, if you're able to see it on the left side, are all those who've been fully vaccinated in Riverside County during this time period. And it was just over 1 million people. And of that 1 million individuals, we had about 3,700 cases of COVID, or about 0.35% of those individuals. And then of that group, we had 23 deaths. So again, 23 deaths out of over 1 million people vaccinated. In contrast, on the right side are the unvaccinated individuals, of which there are approximately 830,000 in this data set. And of that group, about 109,000 of them developed COVID. And then from that group, we were 2,000 deaths. So, if you're about 1 in 300 vaccinated individuals in Riverside County developed a post-vaccination infection. In contrast, about 1 in 8 unvaccinated individuals developed a COVID infection. So really quite striking in terms of that data. And we could go to the next slide. And we won't go into detail, but the last 2 bars in this graphic just show how the new cases are broken out by either unvaccinated or individuals. in dark, in sort of gray blue, or vaccinated individuals in red. And you can see the last couple months, we've had an increase in cases in vaccinated individuals, especially with the Delta variant. So 15 to 17% of the new cases are occurring in vaccinated individuals. Next slide. But overall, again, if we look at, for instance, the deaths on the right side, about 97% of all the COVID-related deaths in Riverside County have occurred in unvaccinated individuals, and about 2.9% have happened in fully vaccinated individuals. Next slide. And then we do get this question a lot about, what's the breakout in terms of hospitalized individuals. So roughly, it's been pretty stable over the past several weeks. About, 90% of the hospitalizations related to COVID are happening in unvaccinated individuals, and about 10% in vaccinated individuals. So what you really see is sort of a progression where the vaccine doesn't prevent all infections. So we're seeing 15 to 17% of the new cases happening in vaccinated individuals, but it does really seem to be protective for serious complication, hospitalization, and death. And so in the hospitalized, about 10% are fully vaccinated, and then again in the group of deaths, about 3% of them have been fully vaccinated. Next slide. And then this one, it may be hard to read, but it just shows the breakdown for children. And, just kind of calling out maybe the last 2 or 3 months when adolescents have been eligible for vaccination. If you just look at that group and you compare the vaccinated and the unvaccinated, in the unvaccinated 12 to 17-year-old group, we've had over 2,000 cases of COVID. And in the vaccinated group of 12 to 17-year-olds, we've had about 60 cases. So we this kind of throughout all of these different groups. So, we do want to share this data out because we know in some cases you may be trying to convince staff, you may be asked about this as a community leader, or, some of this data may also help you with conversations with your patients. So then finally, before we jump into the questions, and I apologize for this lengthy overview today, just for anybody who might have missed the news, President Biden, his administration did put out kind of an announcement for a 6-pronged COVID strategy for improving vaccination rates. And they're actually largely based upon things that we've already done in California. So if they sound familiar, that may be why. The first one is a little bit, is kind of leveraging the Occupational Safety and Health Administration rules. And what they're planning to do is require vaccination for all those employers who have at least 100 employees using an emergency temporary standard. And this, they believe, will impact about 80 million workers across the US. The second strategy that they're planning on is requiring vaccination for all federal workers, including contractors. The third one is to require vaccination for all healthcare workers that work at places receiving Medicare or Medicaid payment. And of course, that's not very, that's somewhat similar to what we already have in California, which is all healthcare workers in certain settings. The fourth strategy is to require either proof of vaccination or testing at large entertainment venues, so places like concert halls or sports venues. And we sort of already have that with our requirements for mega events. And then finally, one of their other strategies has to do with making sure that employers are giving time for employees to get their vaccination. So those are some of the main strategies. I might have missed one, but they really mirror things that we've already done in California.
First question that's submitted is, what is the county's position on school closure and remote positivity rate and cases?
Yes, so, of course, with schools opening, we have seen positive cases. And schools have been stressed, especially when they've had to quarantine teachers, and in some cases, they've been short on staff. Again, with the numbers that we're seeing, we're actually now starting to see a downward trend in positivity in cases, but certainly as of a couple weeks ago, those numbers were still rising. In general, we do not have a magic threshold or a lever in which we would say, we think at this point a school needs to be closed. And that is in alignment with kind of what we've heard and received as goals from a federal and a state level, that in-person instruction, especially for our K through 12 students, is a priority. We were worried about learning loss, as well as lots of unintended consequences of kids staying at home and doing a remote distance learning. And because we feel like we now understand well enough how to prevent transmission, especially with basic precautions like masking, we do not have a threshold in Riverside County or the state of California for sort of closing a classroom or closing a school. Now, schools may choose to do that if operationally they don't have enough staff, or they feel like they need to. So I don't know if that answers the question.
Next, Riverside County schools are giving parents home test kits and then flooding doctors' offices with parental requests for notes. Doing this does not reflect integrity in testing and has high possibility for false tests. Is the Public Health Department aware of this problem, and can they intervene and address this issue? How do you recommend physicians respond?
Yeah, so thank you for that question. So, first of all, the Public Health Department is aware that schools have recently started this practice, and we are sympathetic because we realize that they're feeling overwhelmed with how you manage positive cases, and then students who are in modified quarantine who've been exposed but who can continue going to school as long as they're getting the testing. What we're trying to do is provide to them best practices for how to manage the testing, including making sure that if we are giving tests to families, ideally we want them to be observed tests to preserve the integrity of those tests. Ultimately, it's not easy to police or enforce this because there are literally hundreds of schools across the county, but we do have a schools team with liaisons for all of these schools, and we're making every effort to support them with best practices as well as encourage their peer-to-peer sharing. In terms of doctors getting bombarded with requests for notes, I'm not sure what type of note the requests people are receiving, so maybe we can clarify through the chat box so that we can touch on that as well, Dr. Singhvi.
Thank you. Please submit your the questions in the chat box. Time permitting, Dr. Leung should be able to respond. Next, do we track breakthrough infections by severity? Also, do we sequence breakthrough infections in Riverside County?
So, we do try to track the post-vaccination infections, which is sort of the newer term. And, we gave some of that data earlier. So, you've heard again that in terms of new cases, about 15 to 17% of them are probably post-vaccination infections happening in fully vaccinated individuals. That about 10% of the hospitalized cases are probably representing post-vaccination cases, and then about 3% of the deaths. We do send off a portion of the breakthrough infections, or try to get them tested, but unfortunately not all of the samples are adequate for sending off. So again, it's a sampling of some of those post-vaccination infections, especially in healthcare workers. We're sending those off. We're sending ones that may involve travel. We are trying to expand that group so that we can get more variant testing in the county.
Thank you. Next, what are the long-term laboratory abnormalities noted after an acute COVID-19 infection?
So great question. So I actually consulted our new, one of our new deputy public health officers, Jennifer Shavinsky, who was working at the CDC prior to joining Riverside County. And her work actually oversaw kind of what happens with patients long-term after a COVID infection. So it's interesting, you know, that she shared that for those who truly fall into this category, actually one of the defining characteristics is that there is a remarkable lack of lab abnormalities. In other words, there's not a good lab to test to see if someone, you know, is having any sequelae from a prior COVID infection. You know, ESR may remain elevated for some time, but again, beyond that, one of the defining characteristics of COVID seems to be that it's very, we haven't found something in our laboratory, you know, toolkit to be able to reliably kind of highlight these patients.
Thank you. What is the current thought on the immunogenicity of the mRNA vaccine as to time and severity of illness?
Yeah, so this, you know, you can hear this being debated in the media. And you know, in other words, how long does the vaccine last? You know, probably a lot of focus has been on what's happened in Israel. You know, Israel's actually a really interesting example to look at. They have about 9 million people, which is about the size of Los Angeles County. And people were very concerned because they started to see an increase in cases as well as an increase in the percentage of hospitalized patients with COVID who were fully vaccinated. And so some people started to say, you know, this really means we need to be vaccinating or providing an additional dose at 5 months or 6 months following the second dose of Pfizer or Moderna. But if you look at the hospitalization data, there's actually a kind of a different story because even in Israel, where they were very worried about the surge, COVID hospitalizations, you know, peaked at the end of August around 1,183 around 750 hospitalizations, which is less than the peak that they had in January, which was close to 1,200. In other words, even though they had an increase in their infections, overall, their COVID hospitalizations have been decreasing. And so this is, of course, a surge compared to what they had, you know, during the summer or during the spring. But compared to the overall time course, their COVID hospitalizations are decreasing. And so that probably speaks to the continued efficacy of their vaccine. So, you know, really the debate is, there's still a lot of debate out there, whether it's 5 months, 6 months, 8 months, or something else. And that's what the FDA will be, and the CDC will be reviewing, you know, starting on September 17th when they convene.
Thank you. Can you clarify the risks of COVID-19 vaccination for women, including preconception, pregnancy, delivery, breastfeeding, and infant immunity?
So I will try my best, not being an OBGYN doctor myself, you know, and to remind ourselves of the context. At one point, you know, the CDC was very vague on vaccinations in pregnant women. And they said, you know, you should talk with your doctor and there's not a reason to not get vaccinated. That stance has since changed, and the CDC and ACOG, you know, are strongly recommending vaccination for those who are pregnant and those who are breastfeeding. You know, when you look at the V-Safe data, which is the data, you know, collected on those who've been vaccinated to see what types of side effects they might have afterwards, the miscarriage rate in those who are pregnant, you know, earlier than 20 weeks is very, very similar to the miscarriage rate that we see in non-vaccinated individuals. So again, in COVID vaccinated individuals, there's a miscarriage rate of about 13%. Non-COVID vaccinated individuals, it's about 11 to 16%. So for early pregnancy, there really isn't any data to show that there's an increase in risk. We do know that if you have COVID, there's an increased likelihood for preterm labor as well as complications related to COVID. In later pregnancy, we also haven't seen any increased risks, and that's including actually several different data systems that are used to track pregnant women as well as kind of outcomes and side effects related to vaccine. In terms of breastfeeding, there have been studies that show that vaccinated women do have antibody that's detectable in breast milk, but we don't have data that goes beyond it. In other words, we haven't been able to demonstrate that breastfed infants, are sort of more immune or less likely to become infected with COVID, and that's probably just because the sample size is too small at this point. So I don't know if I missed anything there, Dr. Singhvi.
Oh, very well said. Next, can a private office mandate a vaccine for all their staff?
So yes, absolutely. And the Department of Justice has weighed in on this, and they have sort of confirmed that any private employer can mandate that their staff be vaccinated. And there are not any legal challenges or hurdles to this.
Geoffrey, before we go to chat box, can you elaborate any update on booster dose or booster shots? Because I hear that WHO is advising not to, take it yet, or this is hearsay. WHO is not in favor yet for booster dose.
Yeah, so there's so much in the media right now that I think in general the public is confused about the state of booster doses. So many people actually think it's already been approved, and of course the booster vaccine for the general population has not been officially approved. Just backing up a step, an additional vaccine dose has been approved and is recommended for moderately to severely immunocompromised individuals. So people with advanced or untreated HIV, those getting cancer treatment, those on immunosuppressive medications, people who've had an organ transplant, et cetera. That group, it's very clear, an additional vaccine dose of Pfizer or Moderna is recommended. For the general population, although the Biden administration sort of telegraphed that they wanted to see the general booster or the booster available for the general population starting the week of September 20th, the FDA and the CDC were pretty quick to say that, before that can happen, we actually have to authorize and approve that. The CDC met approximately 1 week ago. They looked at some initial data through their advisory committee on immunization practices. And on first glance, they actually kind of telegraphed that they don't think there's enough data right now to make a recommendation for the general population to boost the entire population. They said, maybe there's enough data on select populations, whether they're healthcare workers or long-term care facility residents. But we really won't know where the coin falls, or until probably another week or two. So the FDA will be meeting on September 17th. They will be reviewing data related to Pfizer. They will not be looking at Moderna or Johnson & Johnson booster data at this time as of yesterday. And after that initial look, depending on what they say, if they make an authorization, whether it's for a subgroup or the entire population, then we would expect that the CDC's advisory committee on immunization practices would meet probably a few to several days later, and then they would make a recommendation. So as of right now, we don't have anything yet. Very difficult to plan because we don't know if there's going to be a booster recommended for a limited group of people at 5, 6, or 8 months, or for the general population.
Dr. Leung, you might have just answered this, but let me phrase the question in a different way. If someone has had the vaccine and then after a certain period has COVID antibody negative, should they get the booster in this first round?
Yeah, so great question. The testing for antibody levels is not a reliable way to check on the efficacy of vaccine at this time. and the reason is we don't know what the level of antibody is that is protective, whether it's after a natural infection or after vaccine and waning. So as of this moment, the CDC does not recommend checking antibody levels as a way to see whether someone might need to be boosted. And with the current guidelines, if someone's already been fully vaccinated and they don't meet the qualifications for moderately to severely immunocompromised, we would not recommend an additional dose right now.
There's another question that came in not through chat, and I think this is on everybody's mind with the healthcare worker requirement to be vaccinated. And so, for example, there's an employee that has had COVID, but it has not been longer than 90 days. Can they go ahead and get the vaccine, or do they need to wait until after the 90 days?
Yeah, so this is also a great question, because at the very beginning towards the beginning of the calendar year, when the vaccine was just made available, but it was a scarce resource, there was a guideline that said, you can wait 90 days after someone's been infected before giving them the vaccine, so that we can prioritize people who need the vaccine the most. However, now that there is plenty of supply for vaccine, our recommendation is that, as soon as someone is out of isolation, generally day 11 after they've developed an infection, that you go ahead and vaccinate them. And so absolutely you can, and it is recommended that we vaccinated people as soon as they're out of isolation, usually day 11.
Okay, thank you. So a follow-up question, it's more legal and you may not be able to answer it. And if not, then RCMA can find this answer through our legal resources. But if a healthcare worker, seeing that you've just indicated that they can be vaccinated less than 90 days after having COVID, but now we're in the window that there's not enough time between to get the 2 shots. So for beginning October 1, healthcare workers have to be vaccinated. If this worker cannot be vaccinated, both vaccines, obviously by October 1, can they get a medical exemption, or are they not able to work until they're fully vaccinated?
Yeah, so this is, this you may need to bring back to your own organization, because we are seeing that different practices are sort of using different sort of transition approaches, especially for employees who are trying to, in good faith, get vaccinated. And so I don't think anybody would want to terminate an employee like that who is partially vaccinated and wanting to get it. But we would probably recommend that you speak with your organization, and if and then you can always rely on your peers as well. But there are a variety of practices that we've seen, ranging everything from people being suspended without pay to getting a first warning, and then the harshest would be kind of termination.
That concludes the questions, Dr. Leung. Dr. Singhvi, I'll turn it back to you.
Thank you, Dolores, and thank you, Dr. Leung, for your services. That concludes our tonight's program. Thank you and have a good evening.